Okay, welcome everyone again. Thanks for your patience as I got logged back into my computer. I'm going to be presenting on substance use patterns among farmers today. I'm a mental health specialist in the Family and Consumer Sciences program here at the University of Maryland Extension. I've been with Extension for about 10 years now. A lot of what I do is related to the opioid crisis, but also I have done a lot of work in the farm stress space. So I'm happy to sort of merge the addictions and the farm stress worlds into this presentation. So we'll spend some time looking at what does substance use look like among farmers and how can we better serve them and better understand what's going on with this population. All right. So one thing to point out is that in the substance use space, there's plenty of research out there regarding the general population and substance use. However, there's relatively less scientific attention that's been focused on substance use patterns among the farming population. One thing that was really helpful in putting together my presentation today was that there was a recent systematic review of research on farming and substance use from back in 2022. And so a lot of the data and information that I'll share with you come from that review, as well as some additional research that has happened since over the past 4 years. So again, the review, which was conducted by someone by the name of Watanabe Galloway in 2022, they had about 42 studies in their review that met the criteria of dealing with some kind of substance use or alcohol issue, the study sample being farmers, and looking at what were the risk factors of alcohol and or other substance use. So some notes about substance misuse in the general population. These are some of the risk factors that apply to everyone in terms of problematic substance use. One is that the earlier that someone begins using any kind of substance, the more likely it is that they will have issues with it later. So, for example, the age at the first time someone has alcohol or tries other substances tends to be associated with the severity of their use later. So the earlier is worse. So for example, if somebody starts, has their first sip of alcohol, at 18, even though that's not legal, that onset is generally associated with less problematic outcomes than somebody that may start drinking when they're 13. So that's sort of what's meant by early onset of substance use. We also know from studies across the nation at this point showing that adverse childhood experiences are associated with problematic substance use. So, we all know the ACEs study, studying 10 forms of childhood adversity that are associated with later adulthood problems. And one of those links is to substance use. There's also, and this is what I'll talk a little bit about in the presentation today, there's also an association between the norms of the community and the amount of alcohol use that occurs within that community. So again, I'll definitely, this is some of the research that came up by in the systematic review that's out there, as well as some of the research in the past 4 to 5 years on norms of substance use within the farming community and how that influences behavior. Of course, depression and other mental health challenges are associated with substance use in the general population. People call this the self-medication hypothesis, that when people are struggling, they turn to whatever they can to make themselves feel better, and sometimes that is substances. Socioeconomic factors are a mixed bag. Sometimes people will associate, the substance misuse with certain classes of individuals, but it's not a uniform picture. So as you can see, lower education and higher income are both associated with substance misuse. Now, the specific substance or the specific issue, I don't have that information right in front of me, but just suffice it to say, substance misuse is not only an issue of a certain socioeconomic status. So these are all the different examples of different socioeconomic factors that are associated with problematic substance use. And as you can see, some of these may be differently applicable to our farming community. For example, small business owners. So drilling down more specifically into our farming population, the review that was conducted in 2022 of all of the studies that had come before it, they found that only 2 out of their 42 studies of farming and substance use focused on something other than alcohol. So a lot of you may be in the space where you're working in in the opioid overdose space and that kind of substance use area. That's not generally, that has not generally been the focus of research on substance use in the farming population. So most of the data is from the United States, but a more recent whole population based study is not currently available, and that's one of the things that we actually need to do a better job of is getting more population-based studies. So let's talk about what some of the findings were related to alcohol use in the farming population. So first, compared to non-farmers, farmers generally had a higher prevalence of risky alcohol consumption patterns compared to non-farmers. One study found that, for example, over half of male farmers and about a third of female farmers engaged in risky alcohol consumption, so things like binge drinking, compared to national averages of 20 and 16%. So you can see it's a lot higher, especially for men. Risky alcohol consumption was also high among farm workers compared to the general population. So there's some studies that came out of Florida and Nebraska finding that around 40% of farm workers were engaging in high-risk drinking. And then an international study from South Africa found even higher percentages of farm workers reporting problematic drinking patterns. So, what are the factors associated with problematic alcohol use? Male gender, younger age, lower socioeconomic status, other psychological problems, isolation and a lack of direct supervision in some of our farming occupations, job demands, extreme work conditions, and excessive workloads leading to distress. Remember our self-medication model. So sometimes, when people are under great amounts of stress, they'll turn to whatever they can to make themselves feel better. Social network pressure, peer pressure, again, thinking about norms. Also, easy access to drugs can sometimes be a risk factor here. So zooming in on job demands and extreme work conditions. So there was a study from North Carolina that took a sample of 371 farm workers. And one of the things that they found was that those farm workers who were sleeping in conditions where, there were five or more people sleeping in a room, which, this does happen, were more than 2 times as likely than other farm workers to experience clinical levels of depression and anxiety. So this can sort of explain the idea of substance misuse as self-medication. So this was not this study wasn't necessarily a study about substance use, but it did show how some of the conditions, especially among farm workers, are conducive to mental health challenges, which then are also associated with increased likelihood of substance use of any kind. So one of the things too is, that, some of the job demands mixed with cultural norms can influence the use of substances and a lot of times alcohol. So there was a quote, I believe from the same study out of North Carolina that said it was a peanut farmer talking, saying, hey, you can get sucked into that so easy. It was always a thing here. We pick peanuts and it's slow. It's harvest time. There's 7 or 8 of us out there working and everybody gets a little cooler and drinks a few. So it's just part of the day's work to just bring your cooler with you during the work. So you could see there in that quote how it's sort of a coping and a cultural norm. It's like this job is grueling, slow, so I'm bringing my cooler with me to cope, and everybody else is doing it, so why don't I do it too? So it's sort of a group thing. So continuing to zero in here, I want to take a look at younger and female farmers. So a lot of the research, because the majority of farmers are older and male, sometimes we miss what's going on with younger and female farmers. So some more recent research showed us that there are issues among relatively young farmers and female farmers in terms of substance use. So this 2024 study, so we're getting pretty recent here, looked at measures of perceived stress, stigma, resilience, and alcohol use. And what they found was that younger female farm owners and managers reported more binge drinking than their male counterparts. So the sample included a large portion of farmers that were between 25 and 40 years of age. So this would be maybe, beginning farmers. And this could be indicating that alcohol was used to cope with the stress of being a beginning and or female business owner. Again, we know that the farming space is, more of a male heavy industry, older. And so there may be some unique stressors faced by people that are, just breaking in and not fitting the mold. Fortunately, there's a lot of resources targeted at beginning farmers, targeted at female farmers. Here in Maryland, we have our Women in Agriculture program, which is really popular. But, they may not be uniformly available. I see in the chat, some of you are from West Virginia, Pennsylvania, Delaware. So there's resources that target new farmers, beginning farmers, women farmers, but who knows how well they're being accessed. So that's something to consider. Okay. Here's a picture. Some people understand things better with pictures. So what this shows is the differences in binge drinking scores from the study that I just mentioned. And is, as you can see, the depending on the role on the farm, there were differences between men and women. So what I just shared, of course, was that female owners were more likely, owners and managers were actually binge drinking at higher rates than men even. And, that's very atypical. Like generally speaking, male, as we said, one of the risk factors of being male is generally associated with more heavy drinking patterns. But in this sample, which I would say close to 1,000 people is a pretty good sample for this type of thing. And in this sample, the women owners and managers were actually drinking more than their male counterparts. Now that is entirely reversed when we think about the typical role. When in the wider population, there may be more women in that spouse role, and they're drinking a lot less. But for those that are in the owner-manager role, there tends to be this higher prevalence of binge drinking behavior. So the role matters. And what this means is that if we accept, this idea of the self-medication hypothesis, that this indicates a need to pour some resources, right, into programs targeted at new and beginning farmers who are women and in an owner/manager role. Because if we assume that they're drinking to cope with stress, which is often the case, this population is experiencing some unique needs there. So I also mentioned that norms will influence behavior. We all know this. When something feels normal, then more people do it. Think about the way cigarette smoking used to be, and now vaping seems to be among younger populations. This is true no matter what kind of norm or behavior we're talking about. So what are these norms for substance use within the farming community? So we had another interesting study by Hopkins and colleagues back in 2023, and they were actually looking at barriers to healthcare. And so again, this kind of like the housing conditions study, it wasn't necessarily about substance use, but it has implications for substance use. So what they found was that many of their interview participants in these rural farming communities reported dissatisfaction with healthcare providers, saying that many doctors did not understand their lifestyle, so much so that one farmer said it's easier to go to a beer store than ask for help. So I bet that sounds familiar to a lot of us. Maybe some of us are guilty of going that route ourselves sometimes. But I think it's easy to understand in the context of farming. We know generationally fewer and fewer people are living in rural areas compared to a generation ago. Fewer people are employed in farming than compared to a generation ago. And so it's right that it's correct that many providers may not really have as close of an experience to farming as people in the past who may have had a close family member, more likely to have had a close family member that are actually in the profession. And so I think all of us can understand that when your healthcare provider doesn't really get what you do and doesn't really understand you, it's hard to connect. It's hard to trust them. It's like they may have accurate information about your condition. Like they may say, yeah, you need to get more physical activity because your blood sugar and all this. But they don't realize that, okay, I have to be still sitting in this tractor or, driving this equipment around for hours and hours at a time. I can't just stop doing that. And so providers having a better understanding of their clientele seems to be making a difference here, and it's actually named in this study as a barrier. So what does that mean? Well, that means that we need another place to pour resources would be to educate healthcare providers about the nature of farming. And again, many of us in extension have such trainings. For example, my colleagues in Delaware and I developed a culture of farming training for therapists a few years back, and that is something that helps mental health providers understand the nature of farming. So that's an example. And there are other trainings that others may be aware of that help educate providers about what is it like to be a farmer. That would be a great resource sharing opportunity. So if anyone in the audience is aware of another type of program that sort of educates educates providers about the life of farming, please feel free to share that in the chat. I'd be curious. So one of the other things that goes into the norms is that, oh, I'm sorry, I got ahead of myself here. There's also norms in the farming community, speaking of the culture, about resilience. Sometimes you're out there and there's no one else that can solve a problem on the farm except you, because maybe your neighbor's, a mile down the road, or the operation is just you and your family. Like there's no one else really to ask for help. And so that's sort of translated into a overall cultural emphasis on resilience and mental health care almost being viewed as an indulgence. It's not that it's maybe unimportant, but it's something that is viewed as like a luxury. Like, oh, I can only take care of my mental health as like if everything else and everybody else is taken care of, because that's just sort of the culture of independence and self-reliance. Okay. So there was another study that came from a different population of farmers in Georgia. And so this gets more at the norms. This was directly about substance use. And they talked about how the respondents, the interviewees in this study, the farmers said that alcohol isn't just a personal coping strategy, but it's a method of providing support to others. So it's sort of this group, like I'm fending for myself, and like we in the farming community are sort of taking care of each other. We're 100% fending for ourselves. It's our problem. It's nobody else's problem. We treat ourselves. And sometimes that treatment could be through sharing alcohol. This was a quote that said, one farmer said, we have a few friends, that even if they can't understand, they don't even try to. They're just like, hey, I'm here. If you need me, let me stop by and buy you a case of beer. And so, he's saying here, like, we may not be able to understand each other's like more complex like family or emotional issues or whatever else is going on. We're not even going to try to go there, but I'll bring you a beer and keep you company. And I mean, okay, the social support is great. But it may also lead to this just kind of normalization of like the way to cope is through the substance. So there's a lot here. Again, most of the studies out there connecting substance use to farming is related to alcohol, just because that's the norm. When you do get at least like regional or statewide studies, we don't really have a great national data set yet. But when you look at these regional and state studies, people in the farming communities are not reporting as much non-alcohol related substance use. But I will share a couple studies that do focus on substances other than alcohol. They're really less so among farm owners and managers and more among farm workers. So there are some limited studies on non-alcohol related substance use in the United States in farmers. Okay, so as I said, a lot of the studies are the limited studies that we have. Several of them have been more focused on farm workers. And so we have a study out of Florida showing that, again, the self-medication model, high anxiety, health problems, financial strain, these things were associated with the likelihood of opioid misuse among Latino farmers, farm workers in Florida. Contrasting this to older farmers in the Midwest, they were actually less likely to accept an opioid prescription, probably because of the perceived risks to their health and to the business. It's hard to operate machinery when you are taking something like an opioid, even if it is prescribed to you for a legitimate reason. And so farmers are aware of this. There's a whole nationwide push for agricultural safety education. And so, people are aware of the risks. And so, for example, there's relatively old research at this point linking opioid use to the risk of subsequent injury. And so, with this awareness and the inherent danger in farming because of the equipment used, there is some reluctance to engage in opioid use in the first place. And when they've been asked directly about about opioid use, a sample in Mississippi perceived it to be more the problem of the greater community rather than among farmers. So again, maybe one of the things you're noticing here is that these are piecemeal studies. This is kind of the state of the research right now. We don't have a nationwide sample that can give us data about farmers in general. And again, that would be useful in a lot of ways, even though farming looks very different state to state. But this is a limitation that I'm acknowledging. I even had our agricultural librarian here at the university help with the literature search just to make sure we're turning over all the stones. And this is what we're finding, just kind of piecemeal, like, okay, a study from Mississippi here, a study from the Midwest here, a study from Florida here. There was one sample of farmers in the Midwest who reported greater use of sample sedatives compared to the general population. But that may not, that's not opioids, right? That would be something like, Xanax or, some kind of medication like that. But that's just one study. So again, the vast majority of our sample here is looking at, of our research is looking at the alcohol use in the population, because again, that's connected to the norms, that's connected to the actual reported behavior of farmers. And so, when we're looking at other substances, we really just don't get a lot of data, or it's focused among the farm worker population. So one more study that came up was that there was a smaller qualitative study reporting that people might know or suspect of other people's substance use, but they weren't saying that I did anything. So again, really not the norm to report anything other than alcohol use among this population. But it is happening. We might need to be more concerned about farm workers for this than the owner-manager category. All right. So, what are some recommendations based on the current status of the research in this area? One, and I've already started to talk about this, we need some bigger research projects that can sort of look at multiple substances at once and get a larger swath of the population. And this would probably require a significant amount of resources. So, for those of you in the audience who may be researchers, in public health or in the agriculture space, you may want to think about, your educational. I know those of us who work for universities, we can't lobby, but you may think about educating our lawmakers about the need for data, and see what they do with that. Because I think you noticed from the research that was presented here, we have a lot of research about alcohol. We see that it's a problem. We see that it's linked to the norms of the community. But for other substances, it's really hard to make a firm conclusion about what's happening, or what the relationships are between different classes of workers and their uses of substance. There's some initial suggestions that other substances may be more prevalent among farm workers compared to the managers, but we don't know. There's just not enough data there. So we need these population-based surveys that measure multiple substances. That will help us begin to get a more accurate nationwide picture of what is going on for this population as it relates to not just alcohol. And then we might even be able to say, like, all right, are there regional influences, for example? Are the rates truly different in one part of the country versus another? We can't do that with our separate studies because they're not all conducted at the same time, all at the same, point in history. And so this point is going to require national level support. I do believe that mental health and the vitality of our farming community, I believe it's a bipartisan issue. And so resources are limited though. And so I think it's going to take a collective effort to educate lawmakers and the like about the need for this wider set of data in order to promote the health and vitality of all. So that's one recommendation. Now, given that we know from the existing research that really our main substance of choice in the farming community is alcohol, we may want to invest current resources into the early detection for drug and especially alcohol misuse. So there are models out there. For many of you may be familiar with SBIRT, oh man, it was just on the tip of my tongue. Screening, brief intervention, and referral to treatment. This is a model where you don't have to be at the level of like therapist or doctor to administer this, like, community health workers, many levels of healthcare professionals can deliver this. But it's basically a way to assess somebody's level of substance use, make a determination as to whether they're in a risky category, and offer them the information and referral to treatment so that they're at least aware of what's out there should they decide to seek treatment. A lot of times in getting people connected to treatment, a significant portion of people don't do it because they don't know where to seek treatment. So resources that go directly to the population of concern would be great. Our mobile health vans, our community health workers who go to the population versus waiting for somebody to come to the health clinic. And when you think about farms, that's really needed, right? It's like they're already not trustful of the health system because like doctors or whoever don't understand farming, don't understand my job. So that even more so increases the need for us to bring these types of interventions to workers where they are. And so, the example here is the expert approach being included in outreach to migrant workers, for example, and making sure that it's in primary care settings. Although, the self-reliance and independence mindset of farmers does make them more resistant to receiving mental health treatment, they will still show up at the doctor's office if it's really bad. And so, so having that resource at the doctor's office is one step that we can take to ensure that the farmers that do show up are going to at least have the chance to be screened for a potential substance use issue. So that's another suggestion. Our study that we had of it was 300 or 400 farm workers in North Carolina showed us that housing can be a problem, among the migrant farm worker population. So the quality of housing is really important for this population, especially when we look at the data from that study saying like, hey, if you're sleeping in a room with 5 people, that's double the likelihood of depression and clinical levels of depression and anxiety, which they're just going to self-medicate because they're out there working 10 hours a day, 12 hours a day. So it's tackling these more basic human needs can go a long way in preventing the problematic substance use patterns in the first place. It may be very hard to change the norms of alcohol just being a normal thing, but you might reduce the intensity of the use in these binge drinking episodes to the extent that they're not having to cope with like extreme stressors. So hopefully that makes sense. Finally, as always, a comprehensive approach to addressing things like mental health, pain management, drug use. Sometimes these things are siloed, but again, thinking of the profession of farming, one avenue that might land people into this like risky space for things other than alcohol is injuries, right? And so with farming though, and especially, if that's your life, your identity, your livelihood, you're injured, you can't work, that's going to be a lot of stress on not just your body, but your mind, right? You're thinking, how am I going to pay bills? Am I still who I thought I was? Think about an older farmer who maybe is in that owner category, getting injured before they were ready to retire and thinking like, oh man, now I have to retire early. Like, who am I? I haven't figured out who I am yet, like without the farming. Like, so you could see like an injury or something could be the door that opens to all these other issues. And so we need to think about it holistically, like make sure we include mental health, drug use, pain management, all that kind of stuff combined when we're working with this farming population, given the nature of the work. And then finally, on a personal note, you will, for those, especially those of you living in rural areas who do know farmers and interact with them on a daily basis, express concern. People are, this is a line straight out of mental health first aid, which I teach a ton of. People are more likely to seek help when someone close to them suggests it. Even a tough independent farmer, and so this is not necessarily a public health suggestion, more of a person-to-person suggestion, that to the extent that we are pointing out when we notice changes in other people's behavior and that we're concerned about them and that there's options, there's resources out there, people are more likely to actually go ahead and seek that assistance. So make sure that you are looking out for your fellow humans, especially folks in the farming community. We know that farming carries with it an extraordinary amount of day-to-day stress. Think about what we've gone through this year in terms of, there was like tornadoes in Talbot County yesterday in Maryland's Eastern Shore, or earlier this week. There's extreme weather, there's droughts, there's things that threaten people's livelihood. And so we want to make sure we're checking in with our fellow humans, and helping them get connected to help when possible. And again, one of the greatest ways to learn how to do that better is to also participate in things like mental health first aid. So if you're curious about that, there's a collaborative of 5 states right now, 5 big state universities: University of Maryland, where I'm at, University of Delaware, Penn State, West Virginia University, and Virginia Tech. We're all collaborating to offer mental health first aid to our rural communities in our states. And so there is someone from one of those universities that I just mentioned in your area who is able to deliver mental health first aid. If you're looking to learn about, how can you, as just a person on your own, help other people. So I've laid out several recommendations that are for a research agenda, public health agenda, but then there's the personal, you to other humans agenda that you can also consume more of our programming to be able to better help others. All right, and I see that Sante hosts mental health first aid at Cecil County. I don't know what DES stands for, but several times a year. Great. So we've got some resources. And Cecil is on the border of three states, right? So Maryland, Delaware, and Pennsylvania. So emergency services, great. Thanks for sharing. Okay, so that's what I have to share with you all. I have a survey that I would really appreciate you all completing. It will help us know how satisfied you were with this information. I've just got my credits and references here. This has been recorded. I'm going to stop the recording now so that people can feel free to ask questions without worrying about being recorded. But I will share a PDF of this presentation as well with the people who registered in addition to the recording. Okay, where is my pause button? Recording. And all right, let's stop the share and stop recording.